Assalamu alaikum students, welcome to Physiologics YouTube channel. In this video, we will be discussing MCQs related to special education, or we can say that the MCQs from the pediatric population or special population. So we'll be discussing an MCQs one by one, and we will be covering the correct answers and also the explanation of incorrect answers of the MCQs. So let's start from question number one. What is the primary goal of physiotherapy in special education settings? Option A, cure disabilities. Option B, enhance academic performance. Option C, improve physical function and independence. And option D, provide psychological counseling. And the correct option is option C, improve physical function and independence. Regarding option A, the word cure is important because some disabilities cannot be cured. And regarding option B, that enhancing academic performance is not strictly our domain. And option D, thus providing psychological counseling, this is also strictly not our domain. Question number two, which term refers to a condition characterized by impaired coordination and balance, often affecting motor skills development? Options are option A dyslexia, option B dyspraxia, option C autism, and option D ADHD attention deficit hyperkinetic disorder. And the correct option is option B dyspraxia. Dyslexia is the learning difficulty that primarily affects the skills involved in accurate and fluent word reading and spelling. Autism is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. And ADHD is an ongoing pattern of inattention or hyperactivity, impulsivity that interferes with functioning or development. Next question is, in the context of special education from physiotherapist perspective, what does IEP stands for? Option A, individualized exercise plan. Option B, individualized education program. Option C, inclusive education protocol. And option D, integrative evaluation plan. And the correct option is option A, individualized exercise plan. Question number four is, what is a common physiotherapy intervention for children with cerebral palsy to improve muscle control and coordination? Options are speech therapy, aquatic therapy, play therapy, and constraint induced movement therapy. And the correct answer is option B, aquatic therapy. Speech therapy is comes under the domain of speech therapist domain, and play therapy can be an option, but most commonly aquatic therapy is used to improve muscle control and coordination. And option D, CIMT. The basis of CIMT is improving the function of affected limb by restricting the use of healthy limb and forcing the use of the affected side. And this is not normally used in the CP child. This is CIMT is commonly used in stroke patients. Question number five, which of the following is a key aspect of promoting inclusion in physiotherapy for children with special needs? Option A, segregation. Option B, individualization. Option C, exclusion. And option D, standardization. And the correct option is option B, individualization. Segregation is when the students with disabilities are educated in separate environments. This is not recommended. Option C, exclusion, when a student is denied access to participation. This is also not recommended. And option D, standardization, that approaches that emphasize common programs. This is also not recommended, as the main purpose is focusing on each special kid's need individually. So individualization is the correct answer. Question number six, which term describes a condition characterized by difficulties in reading, spelling, and writing, often associated with neurological factors? Option A, dyscalculia. Option B, dysgraphia. Option C, dysphasia. And option D, dyslexia. And the correct option is option D, dyslexia. Dyscalculia is a specific and persistent difficulty in understanding numbers. Dysgraphia is a disorder of writing ability at any stage, and dysphasia is a common disorder that affects movement and coordination. Next, question number seven is, what is the role of physiotherapists in supporting sensory integration of children with special needs? Option A, minimizing sensory input. Option B, ignoring sensory issues. Option C, facilitating appropriate sensory experiences. And option D, avoiding any sensory stimulation. And the correct option is facilitating appropriate sensory experiences. Minimizing sensory input is not a role. Ignoring sensory issues is strictly not recommended, and avoiding any sensory stimulation is also not recommended. So you have to facilitate the sensory experiences appropriately. Question number 8. In the context of special education, what does the term gross motor skills refer to? Option A, fine movements of fingers and hands. Option B, large muscle movement of the body. Option C, coordination of eye movements. And option D, cognitive processing speed. And the correct option is option B, large muscle movements of the body. This is termed as gross motor skills. And when we talk about the fine movements of finger and hands, this is called fine motor skills. Question number 9. Which therapeutic approach involves using activities that are enjoyable and meaningful to the child to achieve therapeutic goals? Option A, cognitive behavioral therapy, CBT. Option B, play therapy. Option C, applied behavior analysis therapy. Option D, psychoanalytic therapy. And the correct option is option B, play therapy. We have to focus on the words that the activities that are enjoyable and meaningful. CBT is a therapy that can help you manage your problems by changing the way you think and behave. Comes under mainly in the psychologist or psychiatrist domain. Applied behavior therapy analysis is a therapy based on the science of learning and behavior. Psychoanalytic therapy is a form of psychotherapy, talk therapy, rooted in the idea that all people are motivated by unconscious desires, thoughts, emotions, and memories. Question number 10 is, what is the primary focus of physiotherapy for children with Down syndrome? Option A, cognitive stimulation. Option B, social skills development. Option C, speech and language improvement. And option D, muscle tone and mobility. And the correct option is option D, improving muscle tone and mobility. Question number 11 is, what is a common mobility aid used by individuals with mobility impairments such as those with spinal cord injuries at the lumbar levels? Option A, crutches. Option B, walker. Option C, wheelchair. And option D, cane. And the correct option is option C, wheelchair. When there is spinal cord injury at the lumbar level, it makes difficult to walk independently using crutches or walkers. So wheelchair is commonly recommended for those having spinal cord injuries at lumbar levels. Question number 12. In the context of sensory processing disorders, what does hypersensitivity refer to? Option A, heightened sensitivity to stimuli. Option B, lack of response to stimuli. Option C, inconsistent response to stimuli. And option D, selective response to stimuli. And the correct option is option A, heightened sensitivity to stimuli. This is known as hypersensitivity. Question number 13. What is the purpose of adaptive seating for children with physical disabilities in a classroom setting? Option A, enhance classroom aesthetics. Option B, promote peer exclusion. Option C, support proper posture and comfort. And option D, discourage social interaction. And the correct option is option C, support proper posture and comfort. So in special education settings, the adaptive seating supports proper posture and comfort of the students. Question number 14. Which therapeutic modality involves the use of water to facilitate movement and promote relaxation? Option A, hydrotherapy. Option B, electrotherapy. Option C, cryotherapy. Option D, ultrasound therapy. And the correct option is option A, hydrotherapy, as there is water word in the MCQ, so it is easy to guess that hydrotherapy is basically the use of water to facilitate movement and promote relaxation. Next MCQ is, what is the term for the process of gradually exposing an individual to feared or avoided stimuli to reduce anxiety? Option A, desensitization. Option B, aversion therapy. Option C, flooding. And option D, reinforcement. And the correct option is option A, desensitization. Aversion therapy is a psychotherapy designed to cause a patient to reduce or avoid an undesirable behavior pattern by conditioning the person to associate the behavior with an undesirable stimulus. Flooding is when the patient is exposed directly and rather abruptly to the fear inducing stimuli while at the same time employing relaxation techniques. And reinforcement is a behavior modification technique in which appropriate behavior is strengthened through systematic reinforcement. Question number 16. Which sensory system is responsible for detecting body position and movement in space? Option A, visual system. Option B, auditory system. Option C, proprioceptive system. And option D, vestibular system. And the correct option is option C, proprioceptive system is a system that is responsible for detecting body position and movement in space. Question number 17. What is the primary objective or early intervention programs for children with developmental delays? Option A, academic acceleration. Option B, delaying intervention until school age. Option C, preventing disabilities. And option D, focusing solely on cognitive development. And the correct option is option C, preventing disabilities. This is our primary objective of early intervention program for children with developmental delays. Question number 18. Which term describes a communication disorder characterized by difficulty with social interactions and repetitive behaviors? Option A, dysphasia. Option B, Asperger's syndrome. Option C, dysarthria. And option D, apraxia. And the correct option is option B, Asperger's syndrome. Dysphasia is impairment in the production of speech resulting from brain disease or damage. Dysarthria is a condition in which there is difficulty in speaking, mainly slurred speech. Apraxia is a disorder of the brain and nervous system in which a person is unable to perform tasks or movements when asked. Question number 19 is what is the primary focus of physiotherapy for children with muscular dystrophy? Option A, enhancing intellectual abilities. Option B, maintaining joint flexibility and muscle strength. Option C, promoting social skills. And option D, improving attention span. And the correct option is option B, maintaining joint flexibility and muscle strength. Question number 20 is which type of assistive technology might be recommended for a child with writing difficulties? Option A, hearing aid. Option B, augmentative and alternative communication device. Option C, braille display. And option D, adaptive keyboard. And the correct option is option D, adaptive keyboard. Question number 21. In the context of inclusive education, what does the term least restrictive environment mean? Option A, a setting that minimizes resources. Option B, a setting that avoids academic challenges. Option C, a setting that promotes social isolation. Option D, a setting that allows maximal participation of a student with disabilities. And the correct answer is option D, a setting that allows maximum participation for a student with spatial disabilities. Question number 22. What is the primary purpose of vestibular stimulation in physiotherapy for children with sensory processing disorders? Option A, improve visual acuity. Option B, enhance auditory processing. Option C, regulate balance and spatial awareness. And option D, increase tactile sensitivity. And the correct answer is option C, regulate balance and spatial awareness because the vestibular system is concerned with maintenance of balance. Question number 23. Which condition is characterized by difficulty with motor planning and execution, often resulting in awkward or uncoordinated movements? Options are dyspraxia, dyslexia, dysgraphia, and dyscalculia. And the correct answer is dyspraxia. Dyspraxia is basically difficulty with motor planning and execution, and dyslexia, as discussed before, is a learning difficulty that primarily affects the skills involved in accurate and fluent word reading and spelling. Dysgraphia and dyscalculia have been discussed in previous MCQs. Question number 24. What role does a physiotherapist play in facilitating transition planning for students with disabilities? Option A, identifying disabilities. Option B, providing academic tutoring. Option C, promoting independence and vocational skills. And option D, recommending medication. And the correct answer is option C, promoting independence and vocational skills. Question number 25. What is the purpose of sensory breaks in a classroom for a children with sensory processing difficulties? Options are increase sensory overload, promote hyperactivity, provide opportunities for self regulation, or eliminate sensory experiences. And the correct answer is option C, provide opportunities for self regulation. So these were the 25 MCQs. Next 25 MCQs will be discussed in our upcoming video. If you have not subscribed our channel before, please do it now so you will be updated when we upload our new video. In case you have any suggestions or questions, feel free to comment down below and we'll try to answer it as soon as possible.